Welcome to Kemptville District Hospital. We're so pleased you've chosen to join the team. I'm Frank Vasello, CEO, and I'd like to speak with you about our commitment to patient and family-centered care and what that means to each and every one of us. Patient and family-centered care is a model of care based on 4 core principles: dignity and respect, information sharing, participation, and collaboration. In its fullest form, patient and family-centered care is about partnering with patients and their families both in the care they receive and at our decision-making tables. The benefits of patient and family-centered care are increased quality of care, enhanced patient safety, and higher satisfaction for patients and staff. Patient and family-centered care is about delivering an exemplary experience to every patient, every time. We created this campaign, The Patient Experience Starts Here, to help us appreciate that everyone who works, volunteers, or delivers services here at KDH has a significant impact on the patient experience. When we put this button on each and every day, we commit to doing everything in our power to deliver the best possible experience for our patients and families. In this video, you will see staff and volunteers talking about how they contribute to the patient experience. I invite you to put on the button you received in your welcome package and think about how you can contribute to making patient and family-centered care a reality here at KDH.
Well, I think because often we're the first person to talk to the patient. We're certainly not the first person they see, but if you've talked to someone on the phone and told them to come in for an appointment and they did not have a good experience on the phone, then they're already coming in with a bad perspective of their day. So by being kind and joking with them or just listening to them, we make that appointment start off really good and they look forward to coming.
Working with patients towards their goals and listening to their opinions and their preferences regarding their care is very important. Involving family members who are also going through the same experience while they're in the hospital is also very important. I can definitely appreciate the role that everyone plays in the hospital as well, because simply put, if any one role wasn't being done properly, it would affect the entire infrastructure. I continually receive positive feedback about the hospital and the patient experience here in Kemptville.
Well, every day my staff are in contact with the patients. So when they go into a room to take their choices for their meal, it starts there because they have to be, willing to sit and listen. Because sometimes a lot of patients aren't able to fill out the sheets on their own, like the selection sheets. So my staff will actually sit with them and ask them what their choices are. Food is a very important thing, so it's a very important aspect of their day when the staff come in. And my staff are very eager to make people happy with what they are able to provide.
I'm a volunteer at KDH and trying to help everybody find out where they want to go. If we have patients that are going for surgery, sometimes they'll be very apprehensive. They won't know where to go and they are maybe confused being in a new area. So I'll try and direct them, and if they are very apprehensive, I'll go with them right up to the surgery area. If I were a person going into a strange place, I would certainly want a little bit of help and a friendly face.
Patients always seem to be very grateful and happy with their stays, even if it wasn't not exactly where they wanted to be or what they were doing. They always seem to leave with a smile on their face. Well, that's our goal anyway.
And then they said Kemptville might have an opening in the convalescence, and I'm like, yes. Oh my God, the nurses, the PCAs, the staffing for cleaning. I've had cleaners come in here and talk to me, just to see how I'm doing. And yeah, it's awesome. They make sure I have all my information for my rides, information about my doctor appointments. I make a lot of my own decisions. They kind of stand in the background and they ask, okay, I'll stand here, you tell me what to do.
This is my second job with public, and I love the patients. I love when I'm in housekeeping, you see patients over and over every day. So sometimes you're the only person they see other than like a nurse or doctor. And I love talking to people.
Each and every patient is important to us. Sometimes patient comes and they forget their appointment, like they are scheduled next day. But we try to accommodate them on the same day because they already They are here, so let's do it. Most of the time they are scared, so what we do is that we just try to explain them where they are. This is the ultrasound unit and what we are doing, and that makes a big difference.
The patient experience starts here. The way I see that is, what if I were a patient here? What if I had a family member who was a patient here? How would I want to be treated? How would I want them to be treated? I'm not frontline, obviously, but I'm helping the units to serve our patients. So what I do does impact the patients in the long run. So I need to do my job to the best of my ability in order to have the patients get the best care they can get.
The whole notion of family-centered care is critically important to quality of care. And it hasn't been a big focus in adult settings, but has become so and is now very much, both nationally and internationally, recognized as evidence of good care in a facility. So I'm very excited to see the direction that KDH is going.
Well, when I wear this pin, I feel very proud to wear it. This campaign is something I'm very excited about. It's the reason why I'm here. It's the reason why maybe a lot of us are here. For me, it's to be able to give back. Some of us have raised our families here. Some of us have grown up here. So at some point or time, we've had to use our hospital. And the care and the treatment that I experienced was when I decided that I too wanted to share that same patient experience with my family, my friends, and my neighbors.
I spent 6 weeks in the convalescent ward, and I must say that when I arrived and I knew I was going to be here for 6 weeks, I thought, there's no way. But you know, it was only a couple of days before I was so comfortable, I was so happy, and I got such good care. They were so committed to seeing me improve and to be pain-free and to get back to the golf course, which they did. The patients do come first. They certainly do care.
So when I think about patient and family-centered care, I think about how those core principles can be applied in how we work with each other. So treating each other with dignity and respect, sharing information, participating, getting involved, working together to find the best solutions. All of this creates a workplace I believe each one of us wants to come to every day, a professional one. So using what you've learned today about delivering patient and family-centered care, use those same principles in how we work together. And welcome to KDH.